In the intensive care unit of the University Hospital Regensburg, doctors and nursing staff are fighting for the life of a young man. A dramatic accident, having occurred on a nearby highway a few hours earlier, requires the fastest possible care for the critically injured patient. In this case, the necessary helicopter transport could only be carried out using a circulatory support system. This system is a small, transportable heart-lung machine that can ensure the survival of the patient in this kind of emergency situation.
Cardiovascular engineering has played a decisive role in miniaturizing these systems in the past years, thus making it possible for them to be used as a suitable instrument in air rescue and emergency medical services.
Die sichere operative Sofortversorgung.
Safe surgical emergency care in all German cardiac surgery hospitals can only be guaranteed when emergency teams are available day and night, ready for action within minutes.
Letztendlich auch für den Cardiotechniker.
For the perfusionist, this leads ultimately to additional stress as a result of on-call duty, emergency duty, and permanent overtime. From this perspective, it is quite remarkable to see the degree of dedication the perfusionist devotes not only to the performance of his job, but also to the advancement and improvement of machines and operating techniques.
With the so-called HIPEC procedure, the hyperthermic intraperitoneal chemotherapy, the fact that tumor cells are more heat-sensitive than normal healthy cells is utilized. The skill and experience of the perfusionist are of particular importance when using this therapy.
In den letzten Jahren
In the past years, technique and treatment procedures in cardiovascular surgery have developed at a rapid pace. The perfusionist has contributed to these developments through dedication, commitment, and above all, professional competence. This clearly illustrates the need for an established training program and the creation of educational standards, thereby ensuring the preservation of this high level in the future.
Wann entlüften Sie denn die Kardioplegie dann?
Professor Dr. Gerd Heimel is the Director of Studies for Medical Engineering at the Furtwangen University.
Genau.
In Bezug auf die Ausbildung ist es uns sehr wichtig.
With regard to training, it is very important to us that we create a university education as a basic requirement for the work of the future cardiovascular perfusionist.
Die Kardiotechnik wird in der Zukunft ein Dienstleister sein.
In the future, cardiovascular engineering will be a service provided for different departments in the hospital.
Sondern in Zukunft wird sich
It will not only be limited to heart surgery, but will also be used in the areas of general surgery, tumor surgery, and pulmonology, thereby contributing significant new aspects to other fields.
in der Zukunft in anderen Bereichen setzen.
Okay, danke. Jetzt mal Stopp.
Up until now, the perfusionist education consisted of different paths and standards of training. Most of the perfusionists working in Germany today are certified by the European Board of Cardiovascular Perfusionists.
Die Aufgabenbereiche der
In the last years, the perfusionist's range of functions has become increasingly more diverse and demanding. This is an enormous challenge, but it also provides the chance to individualize the career structure. For this purpose, it is necessary to determine clear official educational guidelines in order to enable the individual to plan his career structure.
besonders im Interesse
Especially in the interest of all affected heart patients, we find it absolutely necessary to finally give the perfusionist professional recognition. This is the only way to secure a consistently high level of care for the patient.
The motivation for this career choice is for many perfusionists to be a combination of interest in technical education, future professional prospects, and above all, the wish through one's work to make a positive contribution to society.
Besonders der Bereich mit den Kunstherzen.
Especially the field of artificial hearts offers the opportunity to stay in contact with the patients and to work with them on a personal basis. This is a little bit different than standing in the operating room where one deals exclusively with the technical side of things. It is really important to me to have human contact, and here are good opportunities to help patients. The Perfusionist's range of activities reads like an aviation pilot's checklist. Therefore, a professional training program is extremely important.
I would be happy if one could assume that nationwide or even Europe-wide, when people carry the occupational title of Cardiovascular Perfusionist, one can be sure that they all have the same professional background.
Hintergrund besitzen. This
is not yet the case, I think, neither nationwide nor Europe-wide, although there are many different certificates available. For this, a standardized educational structure is necessary.
Ist notwendig.
The enormous responsibility for the life of the patient is particularly demonstrated with the AICD therapy. Patients with cardiac dysrhythmia can suffer sudden cardiac death. This is avoided by implanting a small defibrillator. This calls for a high level of competence in cardiological diagnostics in order to optimally adjust the technical parameters to the individual needs of the patient. With the use of artificial heart systems, an acute or chronic cardiac failure can be successfully treated. Additionally, they can help bridge the waiting period until a heart transplantation is possible.
Ohne die Unterstützung durch
Without the support of an artificial heart system, today many patients would not have any chance of survival.
The 6-year-old Lara has been waiting for over 2 years for a donor heart. Her survival since then has been ensured by the so-called Berlin heart, a pneumatically powered circulatory support system. Today, Lara is looking forward to an outing to a botanical garden near the hospital. The perfusionist prepares the engine's console and accompanies Lara and her family on the outing. This way, in the event of an emergency, somebody is immediately there to help with a potential problem.
When parents or patients say to me, "Only because of your work I'm still alive today," I am able to deal so well with my disease. When I can help people with my knowledge, I'm always prepared to do so and hope that with this, I can also further our cause. For me, being a perfusionist is a real calling.
Perfusionists, for whom their job has become a profession for life and who draw strength out of a vocation that should finally find professional recognition.